Okay, so I'm here with
Yep.
Dr. Jane Shomof, and we're talking about giving birth during the pandemic. And I met Jane, I don't know, a couple weeks ago through kind of a mutual colleague, and we just had such a blast talking. And I immediately asked her to come on here and chat with you. We have a very similar kind of mission for why we started our businesses. So
Mhm.
she's the perfect person for me to introduce to everybody in the Savage Wellness, Mama Mecca community. And she's a great fit. So let's listen to her give a little bit more of an introduction about who she is, and then we can get started talking about birth and pregnancy and all things COVID and pregnancy birth related.
So exciting. Hi, Shannon. I'm happy to be here. Hi, guys. Thanks for tuning in. So I'm Dr. Jane Shomoff. I have a wonderful company called Bloom that's specifically dedicated and devoted to helping moms plan for, prepare, and feel supported into and throughout their postpartum period. I basically started the company because I have 3 kids myself, and I'm sure you guys will feel the same way if you've had a kid yet, that giving birth to your first child and having that first experience postpartum is not what you would expect it to be, especially if you're not armed with the information that you need to know. We basically have been preparing for these births, right? You do everything. You do the classes, you take the hospital tours, you do everything you need to do to prepare for the birth as if that's the grand finale, when ultimately that's often a day or a few days,
Yeah.
and then you give birth, and then life really gets crazy. Then you're hit with all this postpartum stuff that you don't know what's normal, you don't know what to expect, you didn't prepare for, you didn't plan for, but you have the space and you have the gadgets and the clothes and that stuff you were ready for. So we want to take some of that guesswork out. I wish I would have had somebody tell me that my anxieties and my fears and my sadness was just as common and just as normal as my excitement and my happiness and my joy postpartum. And so that's really why I created Bloom. I actually never thought I was going to be in this field. I used to specialize, and I still, dabble here and there and consult in addiction. That was my specialty going into the psych field. And after I had my third kid, and I realized that not much has changed. Like the support level is still not there, and there's a huge gap in care in that most crucial, most vulnerable time, which is the 0 to 3 months postpartum, that I needed to step in and bring this idea that I've had bubbling for years into fruition. And so here we are.
That's awesome. I mean, and again, it's very similar to my origin story. So I think that's why it works really well. We both had this sort of postpartum depression, not sort of, this postpartum depression that overwhelmed us to the point where there was this support system we both felt like we needed that wasn't there. And so we set out to create that. What can we do to not have you be prepared with the stuff and the things and the clothes, but like mentally and physically and technically, like you have a baby, but also now you are a mom, and that's the part
Right.
that's not as supported. We support the baby, but like this transition into motherhood is huge, and we don't really have anybody guiding us. We're different people now. We need a new routine. We're a new person. We need to bounce
Yeah.
forward instead
There's
of
no bouncing
backwards.
because if you're bouncing, you're going to pee yourself. So that's a
No bouncing, don't
no
please.
bouncing. That
That's
should
so
be
funny.
like what something the doctor says.
I
Like no
know.
bouncing for several weeks, maybe
Yeah.
not ever.
Yeah. Don't bounce back. Don't even try.
Uh,
You'll just pee yourself. Okay. So we were just talking about removing expectations, which is a great lead into sort of our
yes, our COVID topic.
topic, which is, why is it important to plan for your postpartum rather than just the birth? What does that mean now? Like in terms of not just making a plan also for the birth, but like the whole experience, right? We need to almost
Yeah.
reframe the whole thing. So, what's your take? What have you been learning and what have you been kind of focusing on during this pandemic?
Yeah. So when I like to plan, for example, for the birth, I think oftentimes having a really detailed birth plan sets you up for failure
Mm,
because then you focus on these details. And whether we're in a global pandemic or not, birth doesn't often go the way that we plan because so much of it is not in our control.
hmm
Um, and so I think having rather than a plan, like a solid detailed plan, I think having goals in mind,
hmm
um, which is, you know, letting go of expectations, trusting your body, having a voice, also listening to your team,
hmm
maybe having some music that you want to play. That's definitely in your control.
Yeah,
Um, and leaving there healthy with a healthy baby. I mean, I also had an incredibly elaborate birth plan down to every single detail. I also didn't want an epidural, but I did want to give birth in a hospital. So I read this like book from, twice, like how to have a natural hospital birth. I already knew it by heart.
hmm
I was like Oprah handing out my birth plans to whoever would like make eye contact with me at the hospital. And ultimately, it was nothing like I had planned.
yeah,
So I wish my birth plan started then. I'm going to meet my baby, and then this is what could happen. This is what I'm going to plan for. And so that's really where it should begin, and maybe having some goals in mind for the birth, but not creating this elaborate plan because sometimes your first experience with motherhood is a failed birth plan. And so you go into becoming a mom already thinking that you had failed in some way. That's a really, sad way to set yourself up.
absolutely. So does Bloom help with that aspect of it, like taking that late stage pregnancy and saying, here's where we need to focus. Let me guide you through your afterbirth plan and I can help show you how your birth plan can look and how to approach it, but here's where we need to focus. Is that sort of
Yeah,
what you guys help with?
absolutely. So we ideally we meet our client in their third trimester, I would say pretty late in their third trimester when they're getting close to kind of wrapping their minds around the
Yeah.
fact that they're going to have a baby soon. At that point, we sit down and we plan. We actually are releasing this week a postpartum plan and guide. So whoever's watching this, again, I'm going to send you the guide, and you feel free to send it out to them. That'll be complimentary for them.
Oh, cool. That's
Yeah.
awesome.
So it includes um, everything you need to basically plan for a successful postpartum period, from what items you're going to need to get for your body, for your aches and pains, to what's normal to expect from with your mental health. That women don't know that our feelings postpartum are kind of all over the place. And so even though we're expecting to be in this complete like matching baby mommy bliss,
Mm-hmm.
oftentimes we have all sorts of feelings, including feeling really sad, mourning your past life,
Mm-hmm.
losing sight of who you are because you're so overwhelmed by everything that has changed, and that those difficult emotions are 100% as common as those positive emotions. So
Yeah.
even going into giving birth, knowing and having those feelings normalized, when you experience them, the idea is you're not going to think that deeply about them because it's an expected kind of side effect
Yeah.
of going into postpartum. And so the
Yeah.
guide and the plan goes through all of that,
That's
including
awesome.
writing down who your support people are going to be, redefining the idea of date nights, how to best plan for food, and you're also included on there to get your pelvic floor and muscle separation. Those are
Hmm.
all perks of postpartum, back on track. So lots of fun things are included on there to really help, guide you into a successful postpartum period, like a easier, more in
Yeah.
control. When you first have a baby and you're holding this incredibly vulnerable, fragile, tiny being that you're solely responsible for their life, it's a huge, huge, huge pressure and responsibility. So
Hmm.
having thoughts like, oh my God, if I drop this baby right now, the baby's going to die. Or like, the baby's going to stop breathing in their sleep. Or having thoughts like, oh my God, I wish I was just like back in my old life. All of these thoughts are completely normal. And in fact, the thoughts about, let's say you're walking up the stairs. I know I would have this thought a lot because I had stairs in my house. I'd be walking up the stairs with my baby and I'm like, oh my God, if I drop this baby, like that is the end of it. Like
Hmm.
I could kill my baby. And it would be such an alarming thought. But actually, evolutionarily, we're conditioned to have these thoughts as new mothers or as mothers with newborns in order to hold on to our child more securely during these moments where it could be a little bit more dangerous. So when you
Yeah.
have that thought, you hold on to your child in a stronger way to protect them more. So in a way, we have these thoughts as a way to help protect our young. But we've started
That's,
to judge ourselves for them, like, how could I think that I must be a horrible mom?
yeah, and just like even just you saying that, I had what I was calling to my husband like daymares. Why am I having these like horrific, gruesome thoughts? Like, and and it really
And
threw
it's
me off. And
mhm.
so knowing that that would is like expected and normal to have these like
Yeah, that is
crazy thoughts
because you want
about.
to, it's because you want to protect your baby. So you're going to protect them from harm. The alarming thoughts, we somehow end up holding on to them and digging so deeply into them that they become this like big, dark, deep secret. When all it was is just a thought that happened evolutionarily for you to protect your child.
Yeah. Yeah, we need more information and more access to the talking points that need to happen. Because as uh, going through postpartum depression and people coming over, how are you doing, Shannon? Not great was generally my answer. And
Yeah.
everybody's like,
I mean,
yeah, it's hard, right? And nobody was like, talk to me about this. Like, what, nobody, I didn't think I was depressed because nobody else seemed concerned. And I was like, well, I'm answering, not great. And like everybody else seems to think like, well, that's having two kids. And so having those talking points that you can go through even in your own head to kind of give yourself those check-ins and be like, is this normal parenthood or am I depressed? Like, are these thoughts things I don't need to be having and dealing with? So having the ability to verbalize the difference between that and just new mom life would have been great. So I mean, I'm a fan because this is exactly the part of motherhood that I also feel very passionate about helping women through. So I'm super excited to have found you. So given this new shift in our kind of everyday, which we don't know how long, and even if things ease up, without a vaccine that's tested and proven, which will take a while, where are we with birth now, and what are the changes that you foresee and that you're already seeing?
yeah, so that's a great question. I'm happy you segued into that. Um, so now transitioning kind of into what, we were supposed to be talking about the whole time, which is
Mm-hmm.
giving birth during this COVID-19 pandemic. So I'm seeing really two sides. So one of the things that I'm seeing is sometimes moms are actually feeling okay about coming home with the new baby during this time because it's recommended anyway that you don't really do too much or see too many people in those early weeks postpartum. At
Yeah.
the same time, I'm also seeing a lot more isolation, loneliness, sadness, fear, anxiety because of everything going on. That women who we naturally would have bits of that anyway, that now not knowing because this virus is still so new and we're learning things every day about it, maybe not knowing how to best protect themselves, their family, and their new child. I'm also seeing a lot of anxiety over giving birth, during this time. Now, this is something Shannon, you and I talked about briefly before we got on this call, which is in the beginning, when even less was known about coronavirus, I think it was a lot scarier. I had
Mm-hmm.
clients that were going into the hospital, and the hospital was crazy, and all these people, like tons of people, all in masks, suffering, not knowing where to go, what to do, lots of different protocols to actually get into the hospital. It was kind of like a crazy scene. And then getting into the hospital, um, and then going to your room, and you also, I know in New York at one point they weren't allowing any support people, not even your partner or your husband. And I think that they've been able to change that to allow one support person. But I believe that in most places, if not all places, you're allowed to have only one support person. So I've seen a lot of kind of sadness in that not going the way that they had pictured their birth to go. So a lot of women wanted their mother in the room, or a sibling, or a parent or a sibling in the room with them when they were giving birth. The fact that they couldn't, it was something that they would kind of mourn the loss of having that experience. But for the most part, they are allowing one support person. Also, now that more things have been known and they've kind of gotten the hang of this, once you're in your hospital room, it's pretty much what you would expect at this point, other than the hospital staff are all wearing masks. And when somebody enters the room, you need to be wearing a mask. You and your husband or partner who's in the room with you should also be wearing a mask when, like, the doctor or nurses come in. Other than that, you're pretty much stuck in your room, sometimes just stuck on that ward. Sometimes they allow you to kind of walk around the ward. Other places, you must be staying in your room. But for the most part, that experience, you're kind of in a bubble. You're kind of in that newborn bubble of being in the hospital room with your baby and bonding, and you have that experience. The big thing that's different right now is the masks. And then when you leave the hospital, I'm finding a lot of women feeling really overwhelmed and anxious, because that's when you kind of step into the real world. And it's a whole new world, right, that we're in right now. And
Right.
that's when their anxiety starts to kind of peak, like, oh my God, this is really happening. I felt so much safer in my hospital room. How do I protect myself? How do I protect my baby? And so that starts to happen. Now, speaking of protecting yourself and your baby, statistically, for the most part, they're showing that this virus is really affecting more of the elderly population. And so very few children and infants get it. It's not completely, like, it's not zero, but it's few, very few. So doing what you would normally be doing, I feel like, I don't know if you would feel similarly, Shannon, but this whole experience of quarantining has kind of brought me back to having a newborn at home.
Yes,
The sanitizer
absolutely.
everywhere, the being
Mhm.
super clean, the staying in your house. It's what you do anyway when you first have a baby. And
Mhm.
so we're all in this newborn bubble in a way without necessarily having newborns.
And taking that to like a different level, the psychological aspect of a transformation in your lifestyle that you're now dealing with. Of, we were here and now we're here. How do we wrap our brains around it? How do we wrap our habits around it? And I'm finding that very similar just with my clients. The way I coach new moms of newborns is now sort of the way I'm coaching all moms right now. This is new. Give yourself grace. All the same things that we had to deal with.
Exactly. And I think that's one of the key words, is giving yourself that grace and that space in a non-judgmental way to go
Mhm.
through all the feelings that you're having.
So I remember, so I would imagine right now they're not really doing sort of those nurseries. I know they don't have them in all hospitals anyway, but for example, ours, they would, if you needed, they would take the baby into the nursery for the night so you could sleep. And I didn't do that. I think a lot of moms don't. But I remember after like the third day, I had been in labor for 3 days. Then I have a C-section. So I'm there. It's probably been 5 days since I slept. And my husband's like, "You're going crazy. Like, you need
Hmm.
to let them take the baby." And I was like, "No, not my baby. He's my baby." And he's like, he just said to the nurse, like, "Do you have a nursery? Can you just take him and not bring him back for, unless until he needs to eat?" Because they kept
Right.
like bringing him back like every 15 minutes. So is
Yeah.
that not an option anymore? Are we not going to be allowed to have that space from our babies if we need it at the hospital?
That's a great question. I think for the most part, they're keeping the baby with the mom,
Hmm.
uh, just because they want to limit contact as much as possible. And so
Yeah,
if
that's
you
what I would
imagine,
think.
yeah, but that could change because there's a lot of new research showing that, young children are not actually carriers and can't really pass anything on.
Yeah.
But, you never know. So I don't know. I guess we'll have to see as new developments
Hmm.
happen if that changes. But I do think that a lot of moms try to keep the baby with them
Hmm.
anyway. Another new development that I had noticed, so now what they're also doing is as you get close to giving birth, they give you a COVID-19 test to make sure that you're negative, right? Have you heard
Okay.
about that?
Mm-mm.
Yeah, so they test you, you know, when you're very close to giving birth. And if
Okay.
they hadn't tested you yet, when you go into the hospital to give birth, they will test you. So they test you and they
Okay.
test your partner, um, or your support person. If the mom tests positive for COVID-19 right before she gives birth, what I was seeing with a lot of people was that if you test positive right before you give birth, when you give birth, you're separated from your baby until you test negatively. So
Right.
that was really alarming. Um,
Yeah.
However, like I mentioned to you, I checked the World Health Organization before we got on our call today, and it says that actually, if you do test positive, you still should have the baby should still stay with the mom. You should still continue to breastfeed, have skin to skin. So I'm wondering if that has changed. It is showing that the virus is not found in breast milk from what they're seeing, so that's all safe. And I wonder if it's also different, depending on where you're giving birth. So maybe check with your hospital to see what their policies are on giving birth with COVID-19. I would say in general, that would be a really great rule of thumb that if you're
Yeah.
going to be giving birth in the next, month or two, or in general
Hmm.
going forward, I would check with your hospital to ask, what their policy is with COVID-19 if you do test positive, just to have a better understanding so you're not caught off guard if, you end up testing positive, which hopefully nobody will, but
Yeah.
just to kind of be in the know and know what to expect
Totally.
going in.
Do you have anything, for example, my best friend had a C-section, a planned C-section, and I was so surprised to find out she was sent home 24 hours later, which, like,
Yep,
for a
I was just going to talk about that.
C-section is really, so I was going to ask your thoughts on that, and then if you had any tips for people with a first-time C-section for that early on. I know for me, like, the pain was, like, confusing to try to quantify the pain and all of that. So I'd love to hear your thoughts on that.
Yeah. So to address the first point of the hospital stay, generally you stay in the hospital for 48 to 72 hours. I think with a C-section, it's like closer to 3 to 4 days. With a vaginal birth, it's about 2 days, sometimes 3 days, depending on if they need to monitor for something. Since this pandemic has started, they had tried to reduce the hospital stay to about 24 hours. However, I do see that that's changing as well. It really depends on the hospital. And I think that,
Mhm.
again, that's why you should check with your hospital to see what their policy is and how long will the hospital stay be if you have a vaginal delivery, if you have a C-section, what their policy is, because some hospitals are still doing longer stays and others are
Mm.
releasing you within 24 hours.
Yeah.
So it really varies by location, by severity of coronavirus, uh,
Mm.
depending on where you live, and by the different policies at the hospitals. In terms of a C-section recovery, that's crazy that she was sent
I
home
know.
after 24 hours. That's crazy.
Yeah.
But, I think, how long ago did she give birth?
Now, I think it's been about a week.
A week. Okay. So yeah, I
Hmm.
think, so many things are changing day to day, but the C-section recovery is definitely harder. It's a different recovery than a vaginal
Yeah.
delivery, um, really requiring a lot more rest and taking care of your where the incision was, icing, having your partner help out as much as possible with picking up the baby, putting
Hmm.
down the baby until you kind of are able to start moving a little bit more. I mean, it's major surgery. A C-section is no joke. I think you need to find a place where you're feeling comfortable with the
Hmm.
pain so that you're not really experiencing the pain. And that's the goal postpartum.
Yeah.
You don't want to be in pain. And the other thing that we don't talk about is when your uterus is contracting back to normal, that you
Oh, yeah.
have contractions postpartum. And actually, the more kids you have, the more painful the contractions are postpartum. I didn't know
100%.
that.
No.
And, my after birth, after my third kid was much more dramatic and
Mm.
painful afterward than it was with my first, second.
Yeah, that's
My
interesting.
uterus is like lazy and like didn't want to go back and was just like bleh, trying to go. It
Hmm.
was really fun.
Well,
But
and the
that's
breastfeeding too, right? Like that, when you breastfeed and it's contracting and it's adds to the pain, not just your
yeah.
nipple, but your
When you
uterus is.
start breastfeeding, your uterus that signals your uterus to contract. So
Hmm.
double whammy right
Yeah.
there.
Well, I mean,
And
it's
and the
even, sorry,
oh sorry.
go on.
No, I was just gonna say that in the topic of breastfeeding really quickly,
Hmm.
which is breastfeeding is hard. It's not what it seems like all the time. You see these beautiful, lovely posed breastfeeding images all over Instagram where everybody just looks like in bliss,
Hmm.
especially when it's your first baby, and even after. I mean, sometimes it's always hard with every child that you have to breastfeed. It
Hmm.
takes a lot of work and practice and understanding and trying and failing and trying and failing until you finally get the hang of it or don't, and it's all okay.
Hmm.
Because a lot of moms, when they can't figure out how to breastfeed right away, or the baby is not latching, or their nipple isn't the right size or shape or is inverted, and they're trying to do all these things to get, or the milk isn't coming in, or they don't have enough milk, or they have too much milk, they're like, I failed. That's it,
Hmm.
you know? Um, to just quickly say that you haven't. It's really hard. As long as your baby is fed, no matter how your baby is fed, whether you're pumping or you're giving formula or you're giving it from the breast, it is all good.
Hmm.
And just again, to go back to that, be gentle and kind to yourself, just like you would be to your
Yes.
newborn.
Yeah. Yeah. Treat yourself like you treat your newborn. I love it. Um, the question I had was kind of about that. Like, when you do you find that now with COVID, there's a lot more that you're taking on as sort of a postpartum, like early postpartum guide? Like, I feel like the stuff that I would have gotten in the hospital, for example, like the breastfeeding help and even the lactation consultant that would come to your room and all these things that really are there for you to have an understanding. Even like putting the Vaseline around the tip of his penis from the circumcision. Like, these things that I can ask the doctor, is this right? Is this normal? And and you don't have that now. So if you're being released 24 hours later or less, I think in some vaginal birth cases, like I feel like a
Hmm.
service like yours is so profoundly necessary to like get on a call with you and be like, help me.
Yeah, totally. And I have seen an upsurge in clients. And what we're doing as kind of a service to anybody is we are providing free kind of call-ins for 15 minutes. If you guys, anybody has a question, a random question about something, no question is too random,
That's awesome.
that you can have either myself or one of my amazing staff um, guide you and answer the questions to the best of our ability, just as a free service to help out, because I know there are so many questions and fears out there right now.
Yeah, amazing. Well, I mean, that's everything I would have wanted. I had so many questions and like, I think we talked about this last time. You go online to search for, like, why isn't my baby sleeping or why is my baby barfing so much? And not only do you get 10,000 responses to search through, you get like, oh, here's a funny clip from an Ellen show, and over here is like a funny
Mhm.
meme. And so you end up like getting distracted by Ellen for 20 minutes, and then
Yeah.
you read something that like I don't know if that makes sense or works for my baby, and you're even more confused. So somewhere where you
Or
can
they have like
really,
the worst case scenarios all over the place. If you Google any like images or pictures like of something, it gives you like the worst, most frightening images. Like,
hmm
oh my God, what is that?
yeah, I mean, I remember specifically there were two things that really shocked me. One was I was breastfeeding my baby and my milk came in late, I think from the C-section and the trauma. So I'm home, my boobs are just like solid, hard as rocks, and I'm
Hmm.
already like, what the fuck is this?
Seriously.
And then I put the baby on my boob, and he kind of like, it's like fire hoses him, and he jumps off, and his mouth is full of blood. And I guess your first like big release, there's a big chunk of blood in there, and it's totally normal. But I just was like, oh my God. And it just shocked me. And I'm sitting there and I'm like, I have nobody to call. Like I don't even know who to ask this question to. Or if there's a
Yeah.
question.
Yeah, and you don't know what it feels like when milk comes in for the first time because you've never had milk in your boobs.
Mm-hmm.
And the amount of like flow that comes out of those nipples, it's like a hose. But
Yeah.
it's like not like a stream, like it's like if you imagine like when you're milking a cow, when you like pull the udders and it's like spraying all over the place.
Mm-hmm.
That's what your boob looks like on
Yeah. It's
your
crazy.
baby's like, whoa.
Yeah. Yeah.
Um,
Well,
but
that's
yeah,
awesome
that's
that you have that for people because we moms need that and somebody to ask those judgment-free questions. I don't know. I just feel like I'm all about that one-stop place for trusted information, and I love that you have that. And I love that 15-minute. That's huge. People should definitely
yeah.
be taking advantage of that.
Holler at us. Yep, definitely. It's been nice. It's been nice. We've had a lot of really, not even necessarily our clients, just like people calling in, and it's been really nice to be of service. I had a mom
Good.
call me when she was driving in a panic to Rite Aid, and it was her first time getting out of the house, and she had a newborn baby because the baby that she projectile vomited 2 times, and I'm like, okay. Babies projectile vomit all the time. It was like my second child's like habit. Like she was just like loved to projectile vomit like all over the place after she ate. I'm like, did she seem distressed? No, she just seemed hungry after. Like maybe
hmm
she had a burp that, just didn't come out and all the milk went on top of it. I'm like, did she projectile vomit 2 times in a row? She's like, no, she projectile vomited once before, like several days ago.
hmm
Like, so why are you driving to Rite Aid to get a thermometer?
hmm
She's fine. You can go home.
Yeah. It's just so nice, like that clarity where you're
Yeah.
somebody that can just like be calm. You're okay. Um,
Yeah. Because it's
it's
so
easy.
scary being a first-time mom.
It is.
So many
You never
unknowns.
know. Well, okay, so is there anything else that we can learn about you and what you do? Any other services that would, are really, I don't want to say popular, but helpful right now, especially during
Yeah.
COVID, that you want to promote?
I mean, I would say the biggest thing is to follow us on Instagram. We post daily. We have lots of stories daily that are just helpful resources to help you feel connected and supported during your pregnancy and your postpartum. It's at Moms in Bloom with an E. And that has a link to our website, any new speaking engagements or webinars, Instagram lives that I'm doing are usually all in there. And just knowing that, we're here to help you get settled in and help you make the most out of your postpartum experience. Don't hesitate to call. There's free 15-minute consultations. See if it's going to be the right fit for you. Like I said, we're also launching our postpartum plan and guide, which is
Cool.
going to be really helpful as
Yeah.
well.
All right. Well, thank you so much. This has been awesome. I think that I love learning about businesses that just fill this void that we all need. So I'm so glad that, I'm not so glad that you had a tough postpartum experience, but I'm so glad that it called you to shift gears and make your way over
Totally.
to doing Bloom. So thank you so much for taking the time to be on here and tell us all about it. And I'm really looking forward to keeping you in this little bubble of Savage Wellness so I can point people to you and keep learning more about what you're doing.
Likewise, Shannon. It was such a pleasure, so much fun. I can talk about this for hours,
I
days,
know.
you know, my jam. Have a great
All
day.
right.
Get back to mom life.
Yeah. Have a good
This was
one.
our
Thanks
little
so
break.
much.
This was our break.
I know. Yay.
All
All
right.
right. Bye.
Bye.